Hi, we are from Group 2E, and then this is my group member that are Hamizi, Siti Jumeaton, Wong Chaying, Atrin Sesulang, and Jesarina. And then this second week, our group was posted in gynecology ward. This is our outline presentation, that is procedure that have been carried out in the ward. And then the second one is the strength and then the weakness of doing the procedure. This is the list of the procedure that we have done in the gynecology ward. That are ECG, blood transfusion, care of the patient for pre and post operation, wound dressing, drain removal, and medication that are intravenous and subcutaneous injection. Now I will explain on the procedure that is ECG in terms of the strength and then weakness when we perform this procedure. Firstly, I will explain the strength. The strength when we perform this procedure, that is, we able to enhance knowledge and skill, especially about medical, surgical, nursing skill. And then the second one is we are confident when perform the procedure. And then for the weaknesses, when we perform this procedure, that is, occasionally we forgot the step of the procedure. And then sometimes the male student unable to perform ECG because the patients unable to give the consent.
Okay, now I will talk about the second procedure that we have done in the ward, which is blood transfusion. For this procedure, the strength is we were able to carry out the procedure correctly and safely. We check the vital signs of the patient before transfusion, during transfusion, and after the transfusion to detect any abnormalities. And then we check the patient's name, IC number, registered number, blood product for the serial number, blood group, RH compatibility, and leakage of bubble in the blood pack. And second, we were aware of the condition of the patient during the blood transfusion and able to provide care as needed. We also reassured the patient to minimize his or her anxiety. And then we were able to explain to the patient and his or her relative about the purpose of blood transfusion. And we also encouraged them to ask questions if they have any doubts. And we have also instructed the patient to inform any healthcare members immediately if he or she felt any abnormalities during the blood transfusion, such as chest pain, shortness of breath, and abdominal pain. As for weaknesses, we felt not really confident when carrying out this procedure, as it has been a really long time when after we have been exposed to this medical surgical procedure. And we also felt slightly confused about how to chart the blood transfusion in the intake or output chart. And then the third procedure is care of patient for pre and post operative. For this procedure, we were able to prepare the patient for pre-operative, such as changing the patient into OT gown, emphasize the importance of fasting, nip oral, administer IV fluid as prescribed by the doctor, and we have also learned that we have to check a lot of checklists before going to the OT. The second one is we were able to build a good rapport with the patient and the family to reassure them and to reduce their anxiety. Thirdly, we were able to provide care for the post-operative patient, such as changing into a normal hospital attire, check their vital signs to detect any abnormalities, and to report any abnormalities to staff if it is present. As for weaknesses, we spend a lot of time waiting to receive the patient in the OT or sending them to the OT, which leads to a heavy workload on others in the ward. Second, most of the time we do not know the procedures that is being done on the patient when sending them to the OT. Thirdly, we did not prepare the complete equipment when sending the patient to the OT, such as lacking tools to check the patient's vital signs, intubation, and oxygen if there was a case of emergency. That's all for this two procedures, and then the next procedure will be explained by my friends.
The procedure that has done in the ward is wound dressing. The strengths are maintain the rules of asepsis and decrease the risk of contamination of the wound, and able to clean the wound from clean to dirty. The weaknesses are the equipment are not prepared well, such as a lack of swabs during the procedure and spend lots of time to clean the wound.
Okay, for the next procedure is drain removal, including removal of suture. So for the strengths, we were able to perform on how to off the drain with proper aseptic techniques. However, it's been a while since we have done this procedure, thus our skills might not as good as what we have done in previous practicum. Next, we were able to remove the drain by cutting the suture and gently pulling the drain out. However, due to the inexperience, we were taking too much time in attending on one patient, in which making the patient a bit uncomfortable. And the last one, we were able to refresh back for this procedure. But the clinical instructor needs to step in a few times to help us for our lack of confidence.
Lastly, the procedure that we have performed in gynae ward is administration of medication, intravenous and subcutaneous injection. The strengths, we are able to apply the secrets to administer medication, which is the right patient, time, medication, route, dosage, and documentation. The weakness, we have lack of confidence, which is because it has been a while since the last time we have performed it. For instance, it is very slow for me to withdraw the IV medication. And the strength, we are able to improve the skills after the first administration of the medication. And the weakness, we were unsure on the correct site for subcutaneous injection, specifically for subcutaneous Clexane 40 mg 40 units. And then we always ask for clinical instructor to confirm the correct site of the injection. So that's all from us. Thank you.